Please introduce yourself.
My name is Jazlin Barela, and I'm applying to the Faye W. Whitney School of Nursing Brand Program.
Tell us about a time when you experienced a situation where a classmate or peer was engaging in unethical behavior and how you handled it.
I've been a college athlete for the last 6 years now, and during my time, I've witnessed multiple ethical dilemmas. As a team, we've had set team rules that we're supposed to follow. One of these team rules is no drinking or attending parties during season. There was one particular instance where one of my teammates had attended a party the night before a game, and I saw her attendance through social media. Now, I knew this was wrong and that it broke team rules, and as a senior and leader on the team, I knew I had to face this issue. So the next morning, I pulled her aside and calmly and politely discussed with her how her actions broke team rules and what her consequences would be. I furthermore told her she needed to apologize to the team and to the coaching staff. Ultimately, this situation went smoothly. However, if it didn't, I would have brought this situation to the other leaders on the team along with the coaching staff to further discuss this situation.
How do you work in a team environment? Tell us about a time you collaborated successfully with others.
I've successfully collaborated in many team environments ranging from athletic teams to medical staff to working in groups at school. One specific example of when I successfully collaborated with a team was when I was getting my CNA certification. I was doing my clinical hours in the nursing home when an elderly man needed help getting in and out of bed to go to the restroom and change his clothes. Due to this man's limited mobility, he required a patient lift assist machine. As a team, we used collaboration and teamwork to safely and successfully complete this procedure.
Share an experience where you received unexpected feedback from a supervisor or coach. What was your reaction to that feedback?
A time when I received unexpected feedback was a little over a year ago when I injured my knee in a soccer game. I got an MRI and the doctor came back with some fairly positive feedback and told me that I only had some partial tears and that I could potentially finish the rest of the season. He only said that I required a surgical scope to further assess the damage. After the scope, he came back with some not so positive feedback and told me that the injury was more severe than they originally thought. He told me that I would require another surgery and that my season would be over and possibly even my career. However, at the time, I had the opportunity to medically redshirt and attempt to come back for a 6th and final year. So that's exactly what I did. I didn't let what the doctor told me discourage me, and I decided to come back and play for one more year. In order to do this, I put in extra physical therapy, strengthening, and conditioning in order to come back within a 10-month time frame for the start of the next season.
Tell us about a time when you demonstrated strong communication skills and a lot of empathy.
During my time in the hospital in the operating room environment, I quickly picked up strong communication skills and a heart of empathy. During my internship at Ivinson Memorial Hospital working with the anesthesiologists, I witnessed many people in various situations. I found that I was able to empathize with patients who were in their pre-surgery or their post-surgery due to my personal experiences. Being able to empathize with them, I was able to connect with them on a personal level and be able to communicate with them on what they needed and how I could help. Because I was an intern, I had limited abilities on what I could and couldn't do with patients. Because of this, it put a major emphasis on communication with the doctors and the nurses. I effectively learned how to ask questions and take on the information that they were teaching me and apply it from patient to patient.
Why should we admit you over other applicants for our nursing program?
What sets me apart from other applicants is my competitive spirit that pushes my drive to improve every day and be the best that I can be at whatever it is that I'm doing. For many years, that's been soccer, but as that chapter of my life has come to an end, that drive will carry over into the next phase of my life. I will use my competitive spirit to be a successful nursing student and ultimately a successful nurse. I have a lot of heart, passion, and pride for achieving my goals, and I believe that these character traits will carry me through this program and help me to thrive, because I believe that whatever I set my mind to, I can and I will achieve. Thank you for this opportunity, and I look forward to hearing from you soon.